It's really wonderful to be coming back to the National Youth Science Camp again and speaking to future leaders. When we talk about the overdose and epidemic, as well as what this office does in the White House, here's a question. Who has heard of fentanyl? Okay, I see some hands. I'm going to ask a question, which is raise your hand if you know what Russian roulette is. Okay, I see few hands. Russian roulette. Okay, does one person want to unmute their Zoom and tell me what Russian roulette is?
Would you like me to explain it?
Yep.
If I'm not wrong, it's a game, I may call it that way, where two people use a gun, load one bullet in it, and spin the wheel and start aiming at their head and shooting. The first one to get shot loses.
Good, and they could die, right? That's the important part.
Yeah, that's the funny part, if we could say it.
Right. Losing is okay, but dying's not. So, and then usually the gun has about 6 slots in it, okay? 6 bullets, and it's 1 out of 6. So I'm gonna ask you a question. If you were to go today and find on social media, and if you're not doing it, some of your colleagues are or will be, I'm telling you. And social media, go on one of the social medias and find yourself let's say a pill to help you with anxiety or help you with anything that you think is a pharmaceutical medication, and you take it. Do you think your chances of dying or losing, quote unquote, are greater or less than playing Russian roulette? Anyone can answer that. Unmute and greater.
Yes, greater or equal. It's the same.
So the chance that there will be fentanyl in those pills is 2 out of 5. That's obviously more than 1 out of 6. So your chances of dying, because this fentanyl is really a very powerful compound. And if you end up getting that counterfeit pill, which is 2 out of 5 chances or 4 out of 10 chances, then the likelihood is high that you will engulf or take a lethal dose. You think it's that pill, but it's not. It's a fake pill, and you could die. And that's happening a lot. I'm going to ask you one more question, and we're going to, have you seen or heard of anyone in your class or school take these types of pills? Raise your hand if you have any pills, any substances. Okay, I'm seeing some hands. Okay, so if you've seen it or you heard about it in your school, this is where you need to be to understand it. So that's important, because the overdose deaths for teens from 2019 to 2020 doubled in 1 year. So they went up about 100%. So that's why it's important. And nowhere is it more important than you all knowing why this is one of the biggest public health challenges that our country faces right now. So this illicit fentanyl is, as I mentioned, often produced. These chemicals come from outside the countries like China as precursors, a little bit of chemistry here. And these are dual use compounds. It could be tartaric acid and some of those compounds that get used for a lot of things, and they're shipped. And then they go to Mexico, oftentimes end up in Mexico, and they're in the labs, they're produced into these chemicals. And then they're handled by domestic criminal organizations here in the United States. And that's what happens. people end up either taking these pills or injecting, but they're thinking they're taking something else. They end up taking this. This compound is very potent or very high ability to kill you. Now, I went to the border up close, down south, both in the air and in the tunnels that drug traffickers have dug up underneath. So that's the problem. That is coming because this drug is very lucrative, it's very profitable, and these folks are very motivated because it is lucrative. So what happens is people are dying, and last year over 107,000 people died. Over 107,000. So if you see all the red here in the counties, those are the ones that have some of the highest rates of death, basically. And why do they die here? Because obviously you have drugs, right? So you have profits. But on the other hand, they don't have the help they need. Like, for example, prevention services for youth, for kids in school, kids in college. They don't know oftentimes enough prevention to not do that. But also not enough harm reduction or making sure we're keeping people alive, giving them the antidote when they need it, making sure that people get into treatment when they suffer from addiction. You have recovery. So all the services aren't available. And then there's all these traffickers that are making profits. And so that's like a one person dying every 5 minutes around the clock, every 5 minutes. So that's like 300 people dying every day. So 300 people today have died. 12 people will die just between the time we're talking tonight. And it's unfortunate. So mostly deaths involve, you see that blue line there, and you see that go way up, and that's fentanyl. But there's also deaths happen from cocaine and methamphetamine. Now, chemically, fentanyl is a opioid, it's a depressant, and cocaine and methamphetamine are stimulants. So they have a different sort of way of stimulating you. And they cause excitement in the brain, the CNS. Now, between 2015 and 2021, just in 6 years, the death rates doubled. So, and we've lost more than 1 million people in this country in the last couple of decades. So the amount of time you've been alive, we've lost about, 1 million people in this country. Now, this is staggering and it's heartbreaking because it's friends, it's families, it's neighbors, people in your community that are losing people. And it's only like the people dying. Think about a pyramid. That's the deaths are just the top of the pyramid. Underneath that pyramid is all those people who overdose but don't die. That's millions of people every year. And beneath that is all those people who are suffering from addiction. That's tens of millions of people. So if you think about the burden of disease, remember there's like incidence of disease, there's the prevalence of disease, and there's a burden of disease overall. And that burden is much greater than just the overdose deaths. So we talked about these two drivers of the epidemic. We talked about untreated addiction, that's one problem. And we talked about drug trafficking, and especially profits. So this is it's a very dynamic. This is the most dynamic, lethal drug environment the United States ever had in its history. Almost 250 years. Can anybody tell me why? Why do I say that and why that's the case? But why do you think is the most lethal environment for drugs today than even, when your parents grew up or your grandparents grew up?
College.
Well, they also went to college. The colleges have been around for a while.
We have more access to it.
Social media and different developments in drugs.
Yeah, so definitely there's more, you could get more, obviously. What else? What else?
All becoming more common.
How available are those?
Great thoughts, okay? Great thoughts, great. So I'm gonna tell you something really dangerous. I mean, it's sort of, that's what's going on. All of those things are right, Okay, you're all correct. It's more accessible. We have more use of marijuana. We have more accessibility, social media, all that. But the one critical thing that has happened is that all of these drugs oftentimes used to be plant-based. You think about cocaine, heroin, marijuana, these are plant-based, organic. And fentanyl is a chemical, it's lab-based, it's synthetic. So we have had this transformation in drug sort of supply going from plant-based to synthetic. Now you can make it in your bathroom if you have the right thing. And not only can you make it, you can make it as lethal as you want. A Pandora's box has been opened. So what happens when a drug is much more lethal is you need less of it. When you need less of it, then you can actually transport this in much less amounts. Like marijuana, if you want to smuggle it across the southern border, you have to bring like tons of it. And then it gets detected because you bring a lot of it. This stuff, you can bring small bags, and you could put a backpack enough to kill a few states. So this is the lethality, and then you can make a lot of money off it. So that lethality, that turning that chemistry is literally like the nuclear weapon being developed. So this is that equivalent in drug policy world, and it's not going back. And that's why we're seeing this increased spike in deaths. We're seeing a spike in people suffering from addiction and substance use disorder. And we're already seeing like a spikes in non-fatal overdoses. So that's an important piece. And that's why I'm focused on talking about fentanyl a little bit, because that's a big driver of both profits for the bad guys, but also treated addiction. It's more important and necessary now to treat addiction than ever before. These counterfeit pills that I talked about, they're everywhere. They are made to look nearly identical to OxyContin or Xanax or your favorite brand. And there's so many countless tragic stories where young people, oftentimes your age, buy pills of social media not knowing they're counterfeit, and then don't make it because they don't even know. The parents don't even know because they're not often habitual users, but they just maybe one time they'll do it, use it, and parents can't understand it. So it's important to get the word out about these pills because, as you can see, the DEA put out this One Pill Can Kill campaign. And you can see on the slide that this is the kind of thing we're trying to distribute and share with people because we've recently been working with Snapchat. You can go see examples of counterfeit pills at dea.gov/onepill, and you'll see those examples, and you say, "Wow, they look like the real thing." I'm a doctor, and I can tell you that I can't tell you the difference. So, because this is happening, it's affecting every part of the community. We're losing $1 trillion a year of our economy because of this. We're also losing almost 25% of our labor force because of this, because a lot of the people that are dying are between 25 and 54 years of age. That's a working age population. So in some way, virtually every family in America has been impacted by addiction. And in his State of the Union speech, in March, for the first time in history, President Biden announced addressing this as part of his unity agenda for the nation. And he basically said, we've got to beat this, basically. So it's important that we're working to stop this death and destruction and help people get the help they need. So the job of my office is it develops and lays out the federal government's plan for reducing drug use, for reducing overdose deaths, and drug trafficking. So right now, what we're trying to do is develop that plan to or we publish it, and we're trying to implement that plan right now to get it out there. So when so many people are dying, what we have in priority is, first of all, to get people the antidote. It's called naloxone, the antidote to fentanyl, because 3 out of 4 people that are dying in this country, when I say 107,000, over 80,000 people are dying because of fentanyl. That means that if you could get this naloxone to everybody that needs it, you could save 80,000 lives right away. And it's not an expensive drug. It's not cheap either, but it's not very expensive. It's simple to give. And that's one of the things. And then when you save them, you want to get them to treatment. That's my second priority right now. We also want to go after the profits of the drug traffickers. And that's important as well. And then lastly, we want to make sure that there's data and science behind what we are doing. So we want to make sure that we have actionable goals and actionable data to pursue those goals. So those are the things that we're doing. Now, the present strategy that we have put out also looking at preventing youth substance use, because I can tell you that the more we delay the youth substance use or prevent it altogether, the much more improved likelihood. Now, anybody, why is that? Why do you first you care a lot about kids not using any drugs? Why is that important? That's
It
not a
affects
hard.
the future of the world.
Say that again, please.
It affects the future of the world.
Well, yeah, but why is it physiologically or scientifically important?
Because their brains are
It
developing.
hurts brain development.
Your body and brains aren't ready for it. In any
Yeah,
way.
so your brain when you're born begins to grow. And it grows rapidly in the first 3 months. It grows quite rapidly also in the first 2 years. And it continues to grow up to the age of between 22 and 25, believe it or not. So your brain is right now in growth phase. And when you introduce these drugs, it messes up with the brain growth. And so it allows then the brain to get confused. So, okay, what is this? Oh, I like this, and then say, okay, I like this type of thing. And it kind of goes into a system where it's very, and that's exactly, if you think about tobacco, for example, why do tobacco manufacturers focus on young minds and brain? You will never, literally, it's hard to get somebody who's 40, 45 years old to become liking tobacco for the first time. It just doesn't happen. So, but the tobacco manufacturers know that. They know that if you don't get them before a certain age, we're going to lose people. I want to lose business. It's the same mindset. They're working in the opposite direction, but it's the same kind of idea. And so we feel in science and in public health is if we can prevent kids up to 25 from using tobacco, alcohol, other things, then the likelihood of them using later is much, much, much reduced because your brain doesn't get sensitized. So that's why we want to protect the brain while it's growing. Now, in the strategy, we've got a lot of things, and I'm happy to be able to answer those questions as when we have lots of historic firsts in the strategy. And part of that's because the challenge is so hard and so deep that we're trying to make sure we're putting people's lives at the front and center. So we're making sure we have treatment for incarcerated populations in jails and prisons. We're making sure that we're expanding access to the drug I mentioned to you, naloxone saves lives. We're getting people the help that they need from harm reduction, meaning we meet people where they are instead of expecting them to come to clinics and hospitals. We want to get rid of the treatments, barriers to treatment, and making sure that there's access almost everywhere. Because right now, less than 1 in 10 people who need the help are getting the help. So if you put all these together, one of the things we're doing is, in the past, the United States drug policy is focused just totally or literally more on stopping the flow of drugs than on helping people with addiction. And part of that's because of stigma. Part of that was not really understanding the science of addiction. And now what's happening is we recognize the science a lot more. And this is another example where STEM drives good policy. So once we understand that addiction is a brain disease and has impacts on everything else in life, So we have to then treat it like a disease, a brain disease. We should treat it just like heart disease or diabetes or high blood pressure. And that's why understanding science and data is so critical to any policy making, but especially drug policy making, because this is way different policy than we had in the past. So our approach has evolved over the decades to now include unprecedented funding for, treatment and helping people with treatment and prevention and recovery. So, while working with other agencies too. So now, have you all heard of FBI?
Yeah.
Okay.
Yes.
Of course.
A lot of yeah, but I'm getting a lot of like scared yeah. Yeah. So how about Department of State Department? Yes. Okay. How about Treasury, taxes?
Yes.
How about CDC?
Yes.
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 How about DEA,
Yes.
Yes.
Drug Enforcement Agency? How about the United States Postal Service?
Yes.
Yes.
All right. So any guess as to what they all have in common? And these are some of the logos of these agencies, including Department of Defense. So what do they have all in common?
They belong to the
Legal.
government.
Okay, they belong to government.
Government.
Okay, what else?
Are they all funded by the government?
Yeah,
They stand for people's well-being.
yeah. So believe it or not, but they, along with 12 other federal agencies, are part of the National Drug Control Program. So they all have a role in drug reduction and or drug prevention or drug treatment. So their drug budget is part of our budget authority of the office. So we oversee the drug-related programs and budgets of these and like 18 federal agencies spanning both public health and national security. So half the job is public health, half the job is national security. And what that means is that we make sure that more than $40 billion with a B in drug control funds get spent on strategies, activities, programs, policies that will help us reduce the drug use and its consequences. So that's what the office does. So our team includes like all the experts on all things drug policy. So we get experts oftentimes from in our office from CDC. We get them from like CMS. We get them from places like the Public Health Service Corps. All these are like science-based agencies. We also get people who work for us from military and DEA and Customs and Border Protection and FBI and many more. So what we're doing is basically, if you think about it, we're working at the intersection of public health and public safety. And that's what we have to do, because we've got an American dying every 5 minutes. And this mission with that has never been more important. So that's why it's important to make sure that we're working to address this challenge. Now, I'll share about myself a little bit, and then we'll have some questions. I'm the first physician, actually, first doctor to serve in this role, and it's an honor to do so. But I'll admit to you, that wasn't always my plan. I attended medical school in India at University of Delhi. On my very first day of class, my dean in medical school basically said, and this is the only thing I remember, everything I guess I blocked out or forgot. He said, when you get through here, you'll not only be graduating as a doctor, but also as a scientist. And that was important, because that's an advantage to be trained in a place where your education includes a focus on public health. You learn how to solve big problems with simple solutions. I'll give you an example. In 1994, there was a lot of polio across the world. And so I worked to launch the first pulse polio campaign. And on the first day it was launched, just in like Delhi, one city, We put 2 million shots in the arms of babies and children, 2 million in one day, in one city. And that momentum carried forward. Other states started to do the same. And 20 years later, polio was finally declared eradicated in India, the whole country of 1.4 billion people. So it was a simple solution if you think about it. Vaccinate as many people as you can. And it worked. It wasn't because of a lot of money was thrown at it or a lot of other resources. It was because it's simple solutions often that have to be scaled up. Oftentimes not a fancy, shiny thing. It's a very simple thing. But it has to be, you have to be persistent and keep doing it. And that's what the implementation science is important. Because we often have a lot of science available to us, but implementation doesn't occur. We know what to do, but it doesn't get done still. And people start looking for other solutions. And that's important. Just to implement what we know oftentimes has great benefits. Now, as a practicing physician, I worked in cities, as big as 25 million people, 30 million people, and rural towns as well, where patients paid me with fresh apple pie and homegrown tomatoes. And that's why my answer for cake. I worked in underserved areas initially. The first place I went to work was a small town called Florala, Alabama. It's literally a very small town on the border of Florida and Alabama. And I began noticing that many patients were experiencing hard times and were really having to choose between buying medicine or food, literally. I saw that. So in my practice, I was helping one patient at a time. But I knew that I could help many, many more by getting involved in public policy, health policy, and change the system. So I went back to school, did my master's public health, so I could change it. And that's what I've been working on ever since, because that interested me a lot, to work at a population health level, in addition to working in an individual health level. So when I went to West Virginia, I became the first Indian American state health commissioner in the state's 150-year history, and pushed forward evidence-based strategies to address the opioid epidemic, including increases in infants born with something called neonatal abstinence syndrome, when they're born dependent on opioids. So what I discovered throughout my career is, for 21st century problems, we're going to need, and you're going to need, 21st century tools. And we don't have a lot of those tools. So there's a lot of opportunity for you, because a lot of times we're still working with 20th century tools to fix 21st century problems. And that's where you all come in. We also know that, while vaccines and pharmacy products will always be important, vaccines and drugs, but so will technological advancement. They will also be very important. But the 21st century prime tool to solve problems is going to be policy. And that's going to make a big difference in the century. That means that policy changes that make it easier to get care, including for addiction and other services, keep people alive. Because all of tech in the world doesn't matter if people cannot benefit from it. For instance, I've treated many patients with substance use disorder who have gone on to lead successful lives. But there have been times in ER, emergency room, where I've been giving them reversing overdose every single shift. So the problem is, why do people keep coming back? Because we don't have good data, good science to follow up people who non-fatally overdose. So if somebody overdoses and we treat them, but we forget about them, well, they'll come overdose again. We'll do it again. They keep doing it until time they fatally overdose and die. But that's not the right way. The right way to have policies that will actually, the first time somebody overdoses, you get them the help they need, get them in treatment, so they don't keep doing it and they don't die. So it's policies that become so important. Because, so when President Biden asked me to take on this role, I was eager to do so, because now we have a real chance to make a difference. And so I'm doing that everything I can to this end. And that includes, speaking with you, the future leaders in STEM fields, or whichever else field you end up choosing. And obviously, as you continue along your journey, I thought it's important to have that discussion and think about that. So now you don't have to raise your hands, but I certainly want to see if you have any questions. And because of the interest of time, I'm cognizant. I certainly want to talk about a little bit of lessons learned, but I want to also take your questions in. I know we've got a bunch of questions in this shared.
Langley will call on you and ask you to unmute yourselves, and then you can, so when Langley calls on you, go ahead and unmute yourself and ask your question. That way Dr. Gupta doesn't have to read the questions.
I can call on one first. So this question, Jacob Hansen of Washington, do you want to ask your question? If you don't have it right off, I can read it for you. Just let us know.
How often is someone simply tricked into ingesting fentanyl versus a deliberate use? Like someone gets a pill they need that just happens to be counterfeit.
It's a good question, and I also want to, like, you guys want to ask anything, like, feel free to ask any questions. By the way, it doesn't have to be just on opioids or fentanyls. So, career and other pieces too. The fact is that people are getting more tricked than we would like them to. Meaning that today, if you take any drug, any pill that is not prescription and gotten from a pharmacy, the chances are, as I mentioned, about 40% that you're going to end up getting that quote unquote tricked or getting a counterfeit pill, which will have fentanyl and potentially lethal doses of fentanyl. So, and that's somebody who's just, wasn't intending to die and it happens. That's why it's important to stay away from those types of situations and not do, as opposed to somebody who suffers from a disease of addiction, goes out and seeks those medications, drugs, and they could be cocaine, and they might be taking cocaine for 10 years. And now cocaine is suddenly cut or mixed with fentanyl, and that person thinks they're taking cocaine and they end up dying because of fentanyl that was mixed in. That also happens. And the third part is maybe somebody who just have addiction and used to fentanyl and they want to seek fentanyl. And then they just get the wrong batch, meaning that they may have higher levels of fentanyl and they could die also. So the common theme here is fentanyl, no good, can kill you. It's easy, and we're making it easy to get help for people, not worth taking the risk.